I understand that you began your medical education at the University of Texas's College of Medicine in Galveston, but some turmoil there on campus prompted you to plan to transfer, and you applied to Harvard and to Hopkins and to Duke, and Hopkins accepted you right away, so you went to Hopkins. How do you think your life might have been different if Harvard or Duke had been more on the ball?
Well, it had been changed enormously. I was very fortunate to be associated with a man like Dr. Alfred Blalock, and that really changed my life. And right from that moment that I became acquainted with him and was privileged to operate and work with him, I really got a new direction in my life and chose to pursue a career in cardiovascular surgery.
You're good, Neil. Well, tell me what Hopkins was like when you were a medical student there. What are your most vivid memories of it?
Well, I know I transferred to Johns Hopkins from the medical branch of the University of Texas in Galveston. And at the time, it was an entirely different climate and existence there. At the time when I matriculated there at Johns Hopkins, it was, I think, in February 1943, and it was still in the wintertime there, and the snow was on the ground, and most of the snow was covered in coal soot, you know, that coal dust that was covered everything in those days, where all the heating in town was made with coal. But it was a different environment entirely. Hopkins at the time was constructed in Victorian days, and the old main building there was typical construction at the time. I must say it was rather depressing to me, having moved from Galveston, where the climate was very mild and even had some sunshine and so forth. We, as medical students, would go down on the Galveston beach and enjoy ourselves. Hopkins was still at the tail end of its winter months.
And a surgeon, I understand your father was a dentist, and so is mine.
Yeah, really.
And I know that dentists are, generally speaking, very deft with their hands. So I wondered if that was something perhaps that you inherited and probably steered you toward surgery?
Well, I must say that all the physicians in my hometown of Houston that I admired the most were surgeons, and I really aspired to surgery if I ever completed a medical education.
Please give me your thoughts on the role Johns Hopkins has played in the history of medical education, research, and patient care. That's kind of a three-barreled question.
Well, my knowledge of the history of medical education in this country and abroad indicates that Hopkins embarked upon a real experiment in medical education. Prior to its beginning, medical education was sort of a loosely organized situation. Hopkins was the first institution to actually hire heads of departments such as William Osler and Halstead, Hugh Young, and Dr. Welch to head up their departments as a full-time activity. And these men were headquarters in the hospital, and if they had any private patients, they took care of them in the hospital. Most other medical schools at the time, particularly for clinical facilities, had a private practice in town and then came over to the medical school for the occasional lecture, and that was most of the exposure that the medical students had to their professors. But Hopkins had an organized faculty which is fairly well endowed at the time, and it was really an experiment in medical education. The requirements for entry into the medical school there were a little bit more severe than other medical institutions. You had to have a bachelor's degree, You had to have a knowledge of a speaking knowledge or reading knowledge of French, German, and English, of course. And it was really considered an experiment in medical education.
And its impact on research or patient care?
And no question about the fact that they had in the basic sciences quite notable scientists who devoted a good bit of their time to and efforts in research and all the basic sciences, and of course in clinical sciences too, as well as medicine and surgery.
And patient care.
And patient care, of course. Teaching at Johns Hopkins was noted for bedside teaching, and William Osler, who was professor of medicine, introduced that concept, and he and his associates really took care of medical students, let them come to the bedside and see how they managed the care and the diagnosis of patients and so forth. It was a different sort of approach.
You mentioned Dr. Blalock, and you had association, of course, with him and with Helen Towsig and with Vivian Thomas. And what were they like to work with?
Well, it was a very inspiring thing for me. I know Dr. Blalock was really a prominent innovator in surgery. He may not have been the most skillful technical surgeon, but I admired his approach to surgery, and the fact that he was quite curious about all of the problems he could encounter during an operation. And he was a very determined surgeon, and when he'd be in a case with a very difficult situation, he really applied himself very vigorously to a solution to some difficult problem. And he'd call upon all of his assistants, or even somebody like Vivian Thomas, who was not a doctor himself, but he would ask for suggestions and advice about what he should do.
During the course of the surgery?
During the course of the surgery.
And you worked with Vivian Thomas as well?
Oh yes, I knew Vivian very well. I worked over in the Hunterian laboratory. We called it the dog lab, but Vivian taught many of us some of his technical skills in the animal laboratory. He was a very skillful surgeon himself, and could carry out all of these procedures unassisted that might take a normal surgeon 2 or 3 assistants to help them through. But Vivian had all of these devices worked out and techniques worked out where he could operate independently and accomplish things in a very skillful manner.
Yeah, I came across a clipping. It was not identified as to the source of the publication or its date, but it was in the Hopkins Medicine Archives. And you said that he could use his hands so gracefully, and that you learned simplicity from him.
Yes, and that's what I'm getting at. He could operate alone without assistance, you know, and didn't have a lot of retractors and so on there. He could simplify things and get his objective accomplished in a very simple and sort of aggressive manner.
And what were the key things that you learned from Dr. Blalock?
Well, I learned a lot about him as a man. I admired him so much for his wonderful qualities, his humaneness, his warmth to everyone around him. People liked Dr. Blalock. The only time I ever saw him express any anger or some personality weakness would be in the operating room. But as a person in the wards of the hospital and in the lecture room and all, he was very tolerant and he was very supportive of our efforts to please him.
Mm-hmm. Yeah, I understand he was sort of volatile in the operating.
He could be, yeah.
And Dr. Tausig, did you have much work?
I had a lot to do with Dr. Tausig, and she and I became very close friends. Knew better than to cause any friction with Dr. Tausig, and we got along very smoothly, although she was sometimes a little bit antagonistic to some of the surgeons that were there. And she and Dr. Blalock were not always fully supportive of each other, and they had some feelings of a competitive position and so forth. Even in the development of the operation, known as the Blalock-Tausig operation, there was some question of ownership, or who was the author of the procedure and so forth, but that was just sort of an undercurrent.
Mm-hmm. You say you learned not to create any friction with her. It was, what would have prompted friction?
Friction?
Yeah.
Well, some things in the diagnosis of the patients, you know, and Dr. Tausig, for example, when new diagnostic methods came in, such as angiography for diagnosis of some of these congenital anomalies, and even cardiac catheterization. She was not very supportive of that, and she and Dr. Blalock sometimes had some friction about the diagnosis and the procedure that should be done in these congenital cases, and also in the postoperative management of these cases.
Speaking of the Blalock-Tausig procedure, what do you remember of the atmosphere in the operating room on November 29, 1944? I suspect that you knew that history was being made on the operation on Eileen Saxon.
Well, yes, there was quite a bit of tension around the surgical department and around the hospital, and it was evident that we were going to proceed with this new and revolutionary sort of approach to the treatment of a cyanotic infant who looked as if the infant could not tolerate general anesthesia, much less a thoracotomy incision. So it was, some people even thought it was sort of a human sacrifice to even undertake such an operation.
And so while the operation was underway, you were right opposite Dr. Blalock, you know, on the operating table, monitoring the fluids. And what do you remember about that?
Well, in the initial operation in that November, Dr. William Longmire was his first assistant, and I was an intern. I had just graduated from medical school about 3 or 4 months before that, but Dr. Longmire was his first assistant in that case. But I stood there, and I was holding retractors and doing what I could to be out of the way, and at the same time seeing what was going on. And it was, I thought, a very interesting experience. Dr. Blalock was there, and once he got the chest opened and exposed, he would ask Vivian, who was standing behind him, for some advice and some supportive ideas of what was going on. But meanwhile, it's true that Dr. Blalock knew what he was going to do. He just liked to have everybody feel like they were part of the team.
And when the...
Neil, I'm going to change cards real quick.
Okay.
Get a drink of water, sir?
Yeah. Ready to go?
Yes, sir.
In an Indianapolis Star story about a year after your first heart transplant operation, which I believe was 1968, you said that that particular operation provided, quote, the greatest moment in my life when he removed the clamps and the heart began to beat. Would that still be the apex of your surgical career?
I think so. It was a very important revelation to me. I was so relieved to see that transplanted heart take over this pumping action that it was really quite an emotional thing for me. It was on the level of, say, that when Dr. Blalock took the clamp off that subclavian artery and the patient suddenly turned from blue to pink. And this was something like that, because when it took the clamp off in the heart transplant, it took it about 4 or 5 minutes before the heart even began to contract. And I was so relieved when it did start to perform and work so well. It was quite a stimulating event for me.
In 1971, at a Hopkins Medical and Surgical Association meeting, you said that bypass surgery would become, quote, the cardiac surgery of the 70s, kind of prescient, I would say. And in 1970-71, you performed 300 of these bypass operations alone. How many have you done overall, did you think?
Well, this is just talking about the coronary bypass operation that came into being then. I think I've probably done about 30,000 of those operations. It became the most common operation done at the time upon the heart. So it was quite a new era in cardiac surgery.
Do you hear from the men and women who've hearts you've repaired and lives you've saved?
Oh yes, I enjoy that very much. It's various times of the year, around Christmas time or other times, or whenever some thing appears in the newspaper, I get a lot of letters from patients. Just recently, for example, I had an event where they brought up a couple of 50-year-old patients that I'd operated on when they were 3 to 4 months of age. And it's a very gratifying thing to see, have those kind of experiences, and having patients who can look back 50 years until they had their operation done as infants and children. It's really a unusual sort of a reward for any man at this end of his career.
I wanted to ask you about the surgeons that you've trained. How many fellows have been your proteges and where they are now? I know that among the greatest impact I think that Hopkins is known to have is that the physicians that have been trained at Hopkins or by Hopkins physicians have kind of gone forth and thrived elsewhere.
Yeah.
I had a 1987 Houston Chronicle article said that fellows and residents from your institute were practicing in 45 countries and 43 states. So that about.
I think that's a very good summary of where our trainees have gone. And I've always thought that at Johns Hopkins, they train people to go into more academic aspects of surgery, and they become chairman of departments of surgery, so some of the most prestigious university programs in this country. Most of my trainees have become expert, accomplished clinical surgeons, and they have not devoted as much interest in the faculty positions as the Hopkins graduates have. Maybe because I didn't inspire them enough to go into a more scholarly life. They saw that I enjoyed very much being a clinical surgeon and enjoying the satisfaction of making people better through surgery. But I must say that the surgeons that I have trained here, the ones that have gone through our full residency program, are some of the best clinical surgeons, technical surgeons of any group that I can name for you.
Okay, thank you for your patience. We are rolling.
About how many fellows and residents have you trained, and where are they now?
Well, we've had an unusual influx of trainees. Right at the present time, we have a society called the Cooley Surgical Society, and in that membership, some 850 members who have either gotten almost all of their training in our residency program. There's a select group, though, of about 100 residents who have gone through our full program, which usually involve at least 7 years from the time they graduate from medical school till they finish our residency program, and they're board certified in cardiovascular surgery, and they're kind of the elite trainees, and they are all over mostly in the United States. So many of the others that have gone just through our fellowship program are distributed throughout the world. So it's the two groups of patients or individuals who have been through our educational program.
This is a broad question, but kind of narrow ultimately. Tell me about being a heart surgeon. In a 1982 profile in the old Baltimore Evening Sun, you said that the most difficult operations you soon forgot. Why is that?
I've forgotten what the source of that quotation was, but...
There was an article in the Evening Sun in Baltimore, and it said that the most difficult operations you soon forgot. I could actually find the quote, well, don't worry about it. Don't worry about it. We won't waste time on it. Just tell me about being a heart surgeon. Why you wanted to focus on the heart as opposed to the brain, or
Well, I think that that operation we referred to, the Blalock-Taussig procedure in 1944, I really felt like that was the dawn of heart surgery. And I've always felt privileged to have been there to witness the dawn and to have the opportunity to pursue that goal in my own career. It was, I thought, a privilege to be there, and maybe I was obliged to continue to expand the whole field.
Is there something about the heart as an organ?
It's been fascinating. It's fascinated surgeons and physicians for a long, long time. It was at one time thought to be the source of life, or life existed in the heart. We know now that it exists here in the brain or in the mind, and not in any organ of the body. They may be dependent upon the heart, the other organs, but the heart is just a servant to the brain.
But it's a very special organ.
Oh, yeah. Well, it's the only organ that you can really see when it's acting normally. And it's always thought that life ended when the heart stopped beating. And we've now shown that life can be continue for a brief period even after the heart ceases to work.
I understand that it was at Hopkins that you trained yourself to tie surgical knots inside of a penny matchbox. What gave you the idea to do that, and why did you do it?
Well, I'm not sure it's very accurate. At the time, I was interested in chest surgery, and I would take one of these telescopes that we had, what we call now a laparoscope, and I would take it home, and I would have a shoebox, and I'd take this telescope with a cautery on it and cut strings inside the shoebox. And somehow or other, some reporter or somebody got that idea that I was tying knots in a matchbox. It just shows how legends get started and so forth.
Well, I'm glad we've given it the lie. we've discussed the role that Hopkins played in the history of medical education and research and patient care. How do you envision the future role that Hopkins will play in these spheres, particularly in cardiac surgery, cardiology?
Well, I think that the Johns Hopkins has established a permanent role in medical advances, and we look to, I think the profession looks to Hopkins to play that sort of a role and participate in innovations and give the medical profession a chance to see a new progress. I think Hopkins is really in a leadership position now and always will be.
At the 1981 opening of the Cooley Center at Hopkins that you generously funded, you showed that you could still spin a basketball on your finger, and you shot the first basket. Can you still spin a basketball on your finger?
Well, I think so. I don't get out and play much basketball now, but I do occasionally shoot some baskets out in the driveway at home and with my grandchildren and so forth. But basketball has been a very interesting activity for me throughout my whole life, and I just invited to go to the Basketball Hall of Fame up in Springfield, Massachusetts. I even have a photograph of myself in a certain part of the Hall of Fame as somebody who's used his basketball ability to further his own life. I'm not a Hall of Fame basketeer, but I am in that section of the Hall of Fame in Springfield, Massachusetts.
Well, I feel awfully stupid not to have brought a basketball to get you to twirl it on your finger. You have one in your office?
No, I'm sorry, I don't.
Well, we missed our opportunity, Mr. Corey. Do you have any questions that you want to ask?
I've got about 100, but we know our time is limited. We have about 5 minutes with you. I want to say that it's been an honor just to come down here. I've worked with Neil a lot on researching you. I belong to your club. I run on your track every now and then, so thank you for that. Mine's a little more broad, I think, and in that, noting your illustrious career, as I was walking around the office over the last couple of weeks, and I said, oh, I'm flying down to Texas, and I'm going to interview Dr. Cooley. It was buzz. Even some young people, is that the guy that the center's named for? Yes, it is. And a couple of physicians that I talked to of note, I actually was mentioning a different field, but I mentioned to Dr. Ben Carson, I just worked on a piece for him, and I told him I was coming. And you inspire, to this day, your reach is still felt at Hopkins greatly with all these great physicians. How do you, it might be a dumb question, but how do you feel like that? I mean, you've had this amazing career that's still touching the lives of practicing people at Hopkins today. If you could answer, Neil, what is it, how does that make you feel?
Well, I just feel fortunate. I don't know how I ended up being a Hopkins alum, but just a fortuitous opportunity that came along and made it possible for me to go to Johns Hopkins, to participate in that early development of heart surgery, and to be associated with all those bright faculty members and then also all of the house staff members. I must say that I'm sort of the only one still standing, some of those Blalock trained surgeons, but I have a strong sense of pride in having had that experience.
And gratified that you're still remembered and inspire people there?
Yeah, that's right. I'm very proud of so many of my colleagues who've been at Hopkins and still younger medical students and people applying for postgraduate education. I'm a strong supporter of the Hopkins program, and I recommend it highly to anyone who is looking for further training. But,
I think we're good.
Anything else, Jay?
No, I think that's absolutely wonderful.
yeah.
Thank you.
Now, if I could have him, you sit there.
That I have been determined since then to do similar things for every institution that's had anything to do with my background. I still support things at my high school here in Houston, and I have a number of things going over in my old high school, which has now ceased to exist. But up at the University of Texas, they just built an $80 million basketball arena there and put my name on it, and I had contributed to that. Mm-hmm. And I have got professorships there at the University of Texas in Austin. Mm-hmm. As chairman of the Department of Surgery here at the University of Texas Medical School in Houston has my name on it. The one in Galveston, who's chairman of the Department of Cardiac Surgery there, is mine.
Well, my biggest legacy is I draw the cartoon of the Johns Hopkins Blue Jay.
Good.
And they actually are going to have an exhibit next year in the Eisenhower Library of T-shirts and caps and bumper stickers and whatever that have my Blue Jay on it. It doesn't quite measure up to.
Well, that's great.
It's my one could have a worse legacy, and but your legacy is as I said in the inscription to the copy of the book on debut, excuse me, awe-inspiring. By the way, I was asking about Dr. Dandy at one point because I have a particular interest in him. When he was a medical student at Hopkins, he lived in my great-grandparents' home for 2 years.
Did he really?
On the 3rd floor. They lived at 1029 North Broadway. And my grandfather and his 2 younger brothers became very close to Walter Dandy, the medical student. And there are actually a couple of letters between Dandy and my great-grandmother in the Hopkins Medical Archives, one in which he wrote her 10 years in 1920, 10 years after he graduated from medical school, saying to my great-grandmother, I will never forget you, you know, for your kindness and your care for me when I was but a medical student. And so I understand Dandy could be pretty volatile in the operating room too, and that everybody was terrified of him. But evidently he was on a personal level, could be very warm and generous to people. But
outside of the operating room, he was really, or outside of the hospital, he was really a very cordial and warm person. You know, looking back on it, Dr. Dandy, in his younger days, became a rival to Harvey Cushing.
Oh, yes.
And I think that rivalry continued even, especially after Cushing left Hopkins and went up to Boston.
Oh yes, no, there was no particular love lost as far as I can tell.
Well, Dandy was a much more capable technical surgeon than Harvey Cushing was. The only reason Cushing made such a great reputation as a surgeon was he had a man working there at Peterbilt Brigham named Bovey, and Bovey developed the first surgical cautery, so that Dr. Dandy could take that cautery and take out a brain tumor without the patient bleeding to death. And that was, he became quite an expert on tumors of the brain, but only because this man Bovey, who was, I think, just an electrician in the hospital there, developed this cautery.
Well, and I know that Dandy came up with quite a number of innovations. To view the interior of the ventricle.
Air. Encephalography, they call it.
Well, I know that Vernon Mountcastle told me a story about once assisting Dandy, you know, because everybody had to go through brain.
Oh yeah, I did.
Yeah.
Yeah.
And you know, you were instructed, don't say anything.
Oh yeah.
And but I don't understand the technical aspects of it, but Dr. Mountcastle told me there was some sort of clip or something, gold, I think he said, that had to come off had to be held in some way,
Yeah.
and he saw that it was askew, and so Dandy was reaching for it, and Mountcastle said, "No, don't use this one, use this one," and gave him that, and everybody else in the operating room froze.
Yeah.
That Vernon had opened his mouth, and he said that after the operation, Dandy just looked at him and said, "Thank you." That was all, the only word he ever said to him. But
Dr. Dandy wore that light on his forehead up
Yeah.
here. It was just a light bulb in it. It got real hot. And I remember I was in the operating room one day, and after this thing got a little bit turned around, Dr. Dandy asked the orderly to come fix his light. And the orderly came in sort of nervously and sort of fixed the light and burned Dr. Dandy on the forehead. And he was furious. He sent the orderly from the operating room. He said, "Get out of here," you know. And the orderly sort of timidly slipped around, going up to a little gallery there. And toward the end of the operation, Dr. Dandy looked up there and said, "Doctor, come down here. Let me show you what we've done now." And here came the orderly. he didn't reckon, he thought the orderly was a doctor. And we all laughed about that, you know.
Yeah.
Because
well, Dr. Mountcastle also said he saw it one time. He was
his son, Dandy Blalock.
yeah.
Yeah.
We're good.
We're good.
Just shooting I've been shooting your hands as you kind of discussed a little bit of things here. And very nice, very nice. Just gonna-
I always thought it was kind of amusing that Dr. Dandy had to come out and watch us play basketball because Dr. Blalock was so.
Well, I read a biography of you, and you were also apparently very adept at ping pong.
That was a funny story. You know, I transferred from Galveston up to Baltimore, and the weather had been just terrible in February and March. Suddenly one day the sun came out on a Friday, and that was the day that Dr. Blalock always had his big clinic with the whole Herd Hall there filled up with people and house staff and everything. And I turned to one of my medical student friends I'd just known for a couple of weeks. And I said, "Well, Lester, let's go play tennis. The only good day we've had, they had a tennis court there in the compound. And so Lester and I were out playing tennis. And sure enough, at about 12:30 or 1 after the clinic, Dr. Blalock was walking across the yard with Bill Longmire and Mark Ravitch and all. And he looked over and saw me playing tennis. He went in to see Dr. Taussig there at the Harriet Lane home. And I told Lester, I said, "You and I are both going back where we came from," because Lester had come from the University of Michigan, and I'd come from Texas as a trainee. Sure enough, Dr. Blalock came back out after about 10 minutes, and he stood there and watched us play a couple of games of tennis. Then he called me over and said, "Mr. Cooley, you play a pretty good game of tennis, and most tennis players play ping pong. Do you play ping pong?" I said, "Yes, sir." I thought of all the time I'd wasted in fraternity house and to Austin and Galveston playing ping pong. He said, "Well, you know, I'm taking Miss Blalock and my children down to Gibson Island. I need somebody to play ping pong with me. Would you like to come?" Would I, you know? So that's how I got to know him on that, just by cutting his class. And there, he wanted somebody to play ping pong with him.
On such things are careers made, I guess.
He was a very, very human sort of a guy. I remember when we got down there, first thing we did when we got to Gibson Island, we were in Bill Rienhoff's house down there, which he had borrowed for the weekend. But he went in, took off his necktie and put on his sneakers and everything. We were going to play ping pong. He said, "Denton, would you go back in the kitchen there and make me a bourbon and water?" And I said, "Yes, sir." And so I went back in there, and I Miss Blalock was there, and I said, Miss Blalock, if I pour this drink too strong, he's going to think that I drink a lot, and so on. But if I pour it too weak, he's going to think that I'm some sort of a panty waist when it comes to drinking. She said, well, Denton, when it comes to drinking, the professor is no panty waist. So I poured about a half of a tumbler with whiskey, and we played a game. After he drank his glass, and after that he said, Denton, I'll make the next round. He went in. I don't know what. And from then on, it was sort of a lost weekend because I realized that he could outdrink me by far. But
well, you inspired me to get some bourbon this evening.
Yeah.
Where do you suggest we go to dinner?
Tonight?
Yeah.
You're staying over at the Marriott, aren't you?
Yeah.
Yeah.
But we can catch a cab. I mean, where would you go to dinner?
Well, the big attraction is Tony's restaurant here.
Tony's?
Tony's, yeah. It's over on Richmond Avenue. You have to get a cab to take you there.
Yeah.
But I don't know of any real good restaurant right in this neighborhood.
Yeah.
So as long as you're going out, I think Tony's is.
Is Tony's Italian, or is it?
Well, it's both that, but he is Italian, but it's really French food mostly.
Well, French food, or maybe we should.
Kathy, you have any suggestions?
Oh, no,
She just took off.
She took off. Okay.
Yeah.
Yeah.
Well,
She trusted us enough
to leave you in our tender care. I can't tell you how grateful I am.
Well, it's my pleasure to have you. I'm honored to be included.
And I hope my questions weren't too stupid.
And I've got it, and I've got the hand stuff that I need, and